the relative contributions, thoracic spine, scapulothoracic, glenohumeral. So we've looked at the relative contributions to the overall stiffness presentation. Overlying all of that are your muscles. So the muscles that we go through now, the ones that attach around the scapula and the shoulder, that are going to influence the range of movement of the shoulder joint itself. So if we start with resting position there. Sorry, good, resting. Now, do you have any shoulder problems I need to worry about? Okay. Yes, we'll get there. So first of all, just in this lying down position, we can start to look at pec minor and looking for tightness. So thinking about the attachment second to fifth ribs and the sternum to the coracoid process. So the process by which pectoralis minor affects the shoulder is how it influences the scapular position, because there's not a direct attachment onto the humerus. So in this position, we're just looking for any sort of increased activity, looking for the relative height of the posterior aspect of the acromion on each side, and you could measure that with fingers to see if they are relatively similar. You can also stabilise the origin of the pec minor, apply an AP, stretch a few times onto the coracoid process to get a feeling of the flexibility of your pec minor, and can you change that relative alignment of the relative height of the coracoid to the sternum, but also the posterior aspect of the acromion to the bed. So you can do that a couple of times and have a look in that position. And then you can reassess here as well. Now obviously tightness of the pec minor can bring the shoulder into an anteriorly tilted position, but it may also limit your external rotation range of movement. And they may report that the anterior chest, the anterior shoulder feels tight if that's part of the clinical condition. So from there, let's go with your pec major. So pec major, you've got a clavicular and a sternal head. Now can I get you to come across to the edge? I want your scapula on the bed, but not the shoulder. Okay. Perfect. So the movements that we're looking for the clavicular head is extension, external rotation. So with this movement, we want to stabilise proximally, extend the shoulder, and externally rotate at 90. Okay? Now, you can prioritise which which component you want to add in first. There's not a strict rule about how you do that, but if you're trying to reassess each time, you want to try and pick a consistent way of testing that. So it may be that you horizontally extend and then you see what range of external rotation there is so that you can reassess that. Now you could argue that if you do some treatment there, they're also going to improve in their horizontal extension. But just try and be consistent in your handling. With muscle length, you need to stabilise one end, move the other end. So clavicular head, horizontal stabilise, horizontally extend at 90, external rotation. Can you feel the stretch there? And then for the sternal head, you're going to bring them up into 120 to 130 abduction, extend, extend, externally rotate.
So will you measure the range? So you measure the range from here to the bed, or just
I'd probably look at external rotation range, going that horizontal is 90, because that the bed, you know, if you're using a different bed or
Yeah.
it may change. With these things, you're looking for a good amount of change. We all know there's error in our measurement, but what you're doing is looking to go someone that's like, say we go here and they can't externally rotate, and then you do some release, soft tissue work, and then they can externally rotate, and then you reassess their standing external rotation range, and it fits into the clinical picture. So we're looking for large changes. A very small change would be like, I don't know, just doing it slightly differently. So pectoralis minor, pectoralis major, clavicular and sternal head, and then we'll do your latissimus dorsi as well. So in this position, again, can I just take the pillow away, sorry. Can I have your other hand? Okay, so latissimus dorsi, internal rotation. So you want to test it in external rotation, so it's thumbs down. Now in this position, we're coming up into flexion. So you can see the latissimus dorsi on stretch. You can also see that that end of the lats is not stabilised. And I've already just said to you, you need to stabilise one end, move the other. So this is a quick test to get a feel bilaterally, is there a difference? You know, if one was up here and one was down there, you go, okay, that looks different. This looks similar. You're looking for how much the scapula is dragged out by the tightness of the latissimus dorsi. But coming into that overhead position, thumbs down, bilateral, get a feel through there. Now I'm trying to stabilise at the wrist too, try not to get that movement. I'm trying to, while I'm thumbs down, I'm also on the distal radial line or radius ulna into there. Now to investigate that further, pop that one down, and again staying in the same position for this part, but now I'm stabilising the ribs so that as I come into that stretch, can you feel that more strongly now? I'm stabilising the origin, moving the insertion of the latissimus dorsi. And you can see there, it feels tight, doesn't it? Also you can see those ribs aren't moving down, and you compare that right and left. Okay, perfect, thank you. So now we're going to do pec major, one more while I've got you here. So also while you're in this supine position, posterior cuff. So you may get an idea of the posterior cuff just coming across into horizontal flexion. What I would like you to do is hand on the back of the shoulder. Now knowing that your scapula is stabilised against the bed, you don't have to hold very much there, but just to get a feel if the scapula is starting to come out. So stabilise a little at the posterior shoulder to go into horizontal flexion. When you add the other components in, you can't do that as well. So move your hand to the elbow, keep in 90 flexion and neutral rotation, and then you're going to go into internal rotation. So you can see, sorry, what's your name? Jason. Jason? As Jason comes to the end of his range, can you see his shoulders starting to come up there? So you need to take up the range of the posterior cuff, which is there. Now if I add in any more, the shoulder will start to go too. So it is take up the slack of the posterior cuff, that's the end, that is extra and starting to get some shoulder elevation through there. So keep your position standardised. You may, like I said, check their horizontal flexion range, but this way you can reassess their internal rotation amount to assess whether your technique or your treatment is improving it. Okay, thank you very much, Jason. So, pec major, pec minor, latissimus dorsi, and posterior cuff.